name's Haley Kogo, and I will be performing a physical exam on Piper. First thing we're going to do is I'm going to watch her walk and make sure everything looks normal. And she's going to, Whitney is going to put her on the scale and we're going to weigh her. She weighs 41.6, so I'm going to record that on my chart. Okay, and now we're going to take her to the exam room. Okay, first thing I'm going to do is I'm going to make sure that Piper is friendly and not aggressive or frightened. It looks like she is. And then I'm going to make sure that her general appearance looks great and everything. The owners told me that she was about a year old. Everything looks good. I'm going to check her capillary refill time. That looks great. It looks like it's about a second. I'm just going to record that. Okay. And first thing we're going to do also is check her temperature. I have my cover slip over my thermometer to prevent any diseases or anything. It's 102.1, so that is normal. Just record that. Okay, and now I'm going to check her pulse. Looks like it's about 31 beats every 15 seconds, so I multiply that by 4, and it's going to be 124. Okay. Now I'm going to check her respiration rate. Looks like it's about 21 beats every 15 seconds, so that'd be 84 per minute. And I'm just going to put on here that she was panting because that is a little high. Okay, and now I'm going to check her eyes, make sure there's not any visible lesions, and make sure she has a good pupil response. She does. I don't see any lesions. Alright, and now I'm going to take a look in her ear. Okay. Easy, girl. Make sure there's no drainage or anything in there. to make sure that her skin looks good and everything. I'm going to check for any external parasites, make sure that her skin looks good and healthy and no redness or irritation. Make sure there's no flea. And I'm also going to make sure that her eyes and everything doesn't have any drainage, and they don't. Okay. And she doesn't seem to have any neurological signs as we watched her walk in the other room. She didn't seem to be knuckling or anything. And now I'm going to palpate her abdomen. Just kind of see if I can feel anything abnormally. Seems to feel good. And now I'm going to check and make sure she has no problems around her rectum or anything. And I'm going to make sure that she doesn't have any problems with her vulva. And everything looks good. And I'm going to check her lymph nodes. Make sure they are not enlarged. Let's do that. Check front of her shoulder. And check the back lymph nodes. Seem to feel normal. Alright, and didn't see any fleas or anything on her when I was examining her skin, so that's good. She hadn't ever had a history of Demodex or any kind of mange, so I think she is definitely in good shape. So I'm going to rate her as excellent. Everything was within normal findings. And then the doctor is going to come in and just kind of take a second look at her and examine her and make sure he doesn't find anything any different. And that's how you perform a physical exam on a canine.